welcome to this ceremony that we're going to do last year. Carolyn and I have been working on this for quite some time. Today's event, we're going to honor all caregivers. We'll dedicate the Healer Touch statue here, and then we're going to walk over to Lakeside and dedicate the statue there, because we're both Daisy Foundation participants, so that is the plan.
My name is Brad Beers. I have the pleasure and honor of serving on your board here at CHI St. Luke's, the Woodlands Hospital. While most everyone here has heard of the Daisy Award and knows that it is an honor to recognize extraordinary nurses, I suspect many of you are like me. You may not have known the origins of the Daisy Award. In late 1999, Patrick Barnes, then 33 years old, was admitted to a Seattle hospital with an autoimmune disease, ITP, I can't pronounce whatever it really stands for. He and his family were no strangers to hospitals. He had survived Hodgkin's disease twice. Like most patients and families, they expected to see clinical skill that dealt with Patrick's complex medical situation. That was why he was in the hospital. Everyone expects to receive great clinical care in a hospital. What the family did not expect was the way the nurses delivered that care, the kindness and compassion they gave their patient and his family every day for the 8 weeks Patrick was in the hospital before he died. Patrick's family needed to say thank you for the gifts nurses give their patients and families every day, just as they had experienced. They formed a 501c3 organization, DAISY, standing for Diseases Attacking the Immune System, and created the Daisy Award for Extraordinary Nurses, starting in Seattle, where Patrick received his care. Their goal was to ensure that nurses know how deserving they are of society's profound respect for the education, training, brain power, and skill they put into their work every day, and especially the caring and compassion with which they deliver their clinical expertise. The Daisy Award, which is a part of over 4,650 healthcare facilities and nursing schools in 29 countries now, is intended as an expression of gratitude to help nurses always remember the unforgettable impact their care has on patients and families, and to inspire nurses to provide extraordinary care, not only with their brains, but also with their hearts.
In the World Health Organization designated 2020 as the year of the nurse and the nurse midwife. As a profession, we were so honored that this was bestowed upon us. Little did we know how the year would turn out. The pandemic has challenged healthcare systems across the world beyond our imagination. We are grateful for the St. Luke's team pulling together to manage the ever-changing world, and for our community support that we experienced through 2020 was impressive. On behalf of the nursing profession, we honestly prefer not to have another year named after us or dedicated to us. The Healer's Touch is what the statue is called, 2020. The sculpture stands in tribute to the nurses of the Woodlands Hospitals, united in compassion, caring, and service. We honor them in this year of the nurse for extraordinary and skillful care they provide their patients and families every day. Hand-carved from serpentine stone by artists of the Shona tribe of Zimbabwe. It's called the Healer's Touch. It's a large version of the sculpture to our Daisy Award-winning nurses. It depicts the unique relationship between nurses create with their patients, and the Shona have profound respect for the tradition of their healers in their own tribe. In that respect is reflected in this sculpture. The purchase of these sculptures provides income for the Shona artist and connects the efforts of extraordinary nurses across the world. So now, I'm going to have Jarrett and his team unveil the statue.